All right. Okay. So happy New Year. Goodness. Happy New Year. It's 2025. Thank you for spending your first Friday of Friday morning of the year with us here in this Community Links space. So just as a quick reminder, if anyone's new to Community Links, this is our opportunity to share about various programs and services in our community. We typically spotlight a program or a topic to help raise awareness about the supports available to families and really to just help to strengthen our collective capacity in this community to better serve families. And the other goal of Community Links is to provide you all with, to the extent possible in this kind of virtual format, but to provide you all with the opportunity to connect with others in the field. So others that are also serving families and to get to know them, to connect with, learn about a new program or agency, or make a connection within a program or agency, just to, again, really strengthen our network here in San Joaquin County. And so in a little bit, you'll have an opportunity to do that. We're going to get into a breakout rooms just briefly for a quick connect, and then we'll come back out and get into the meat of our meeting today. But before we do that, a little bit of housekeeping. Please, just as a reminder, I know we all know the rules of Zoom, but just keep yourself on mute. But if you do have a question or a comment or that you want to raise, please feel free to mute yourself. This is not super formal. We want, to the extent possible, for this to be as interactive and informal as possible. And so please unmute yourself, or you can place a comment in the chat, which I'll be monitoring throughout the meeting. Also, I feel like a little bit of a broken record when I say this, but we love to see your faces. So thank you to those that have your your cameras on. It's great for engagement, and it's also great for our presenters to have actual faces to speak to. So thank you for those of you that have your cameras on, and to others, we invite you to turn on your camera this morning. Okay, so just a quick review of our agenda. So we are going to, in a moment, break out, but feel free to introduce yourself in the chat if you haven't already done that. But you'll have the opportunity to introduce yourself in a small group setting in just a moment. But today, our topic spotlight is on the importance of vision and hearing screenings for young children. And we know that some of you are are engaged in this and may even be required to provide this level of service to the families that you serve, depending on the type of program or curriculum you utilize. And so this is a great capacity building opportunity, learning opportunity today. And for others, it's just a great way to raise awareness about the importance of young children being screened, receiving vision and hearing screenings. So thank you to UCP, who's with us today, who'll be presenting in just a moment. And then we'll have either throughout the presentation or at the end of the presentation time for you all to ask questions um, of our speakers and to engage in some dialogue around the topic. And then we'll end the meeting as usual with some updates that or announcements that you all have to share with the group today. Okay. All right. So in your small group, and I'm going to put you into small groups now. You just give me a moment to do that. If you could, in your small group of four, five, or six, share the agency that you're with, the program that your name, of course, but also the agency and program that you're with, and the types of services that you provide to families. And if you could, as we're kicking off the new year and we all vowed to be just healthy and well this year, right? What is your best wellness tip? Right, so, I hope you guys got some good wellness tips out of that segment. We're going to transition now to our topic focus for the day. As I mentioned, where our focus is on the importance of vision and hearing screenings for young children. And so we're really excited to have Lisa Pickens with, I'm sorry, that is a typo. That's not CPC, but Lisa Pickens is an early interventionist and an audiometrist with UCP, and she'll be covering this topic today. So thank you so much, Lisa, for being with us. And I'm going to stop sharing, and I'm gonna now reshare your PDF. Okay, Lisa, it is all yours.
Okay, good morning, everybody. Again, I apologize for the delays. We had to switch computers at the last minute and news to me. So the presentation today is on the importance of vision and hearing screening for children ages birth to 5. And we will move forward. Next page, thank you. For normal and typical hearing milestones, we start with birth and go up to 3 years on this particular program. And so if a child startles and cries at loud noises after they're born, um, turns their head to a sound source, um, then you know typically that things are going okay for their development or hearing. And then by 6 months, they distinguish between the sounds of a human and from other sounds such as dogs barking and things like that. They'll turn their head to the dog or vacuums, things like that around the house. And by 1 year, they'll respond to their name, understand what no means, well, for the most part, until they're a teenager. And then they recognize syllables and like mama, dada, they might actually start doing a vowel shift around this time, saying mommy, daddy, recognizes syllables, turns to sounds on either sides of them, uh, such as if you make a sound on the left or dad walks in on the left, they'll turn their head to look that direction if dad's talking or there's footsteps. And same if mom walks in from the right, they'll turn to the right to look at mom. So from 1 to 3 years, they'll begin to associate words with the objects they represent, respond to a request to point to objects pictured in books, and understand questions when given verbally. Um, so, any questions on that area? Okay, next page. Okay, so the concerns that might come up as something a parent or professional working with them is we would consider that to be a hearing red flag. So a red flag would be a family member with a hearing loss, mother that may have had an infection during pregnancy that could possibly have elevated her body temperature. Child weighing less than 3.5 pounds at birth or is prematurely born. If mother drank alcohol or abused drugs, etc., during pregnancy, all big risk factors. If the ears have an unusual shape on the outside, um, there's a term called microtia, which means like the ear's really small or malformed. That could be an indicator that there may not be an auditory canal or a properly developed auditory canal. If let's see here, if the child had jaundice at birth or needed a blood transfusion, also red flags. Meningitis, neurological disorders, if the child was in the NICU for any other treatments after they were born. If the child has had a serious head injury, high fever, exposed to loud noises frequently, if they received an intravenous antibiotic as a newborn, if they're not responding verbally with intelligible speech, and usually parents are the first ones that pick up on this, that they can't even understand their own child, that will be brought up. Many times that's brought up. Or sometimes the parent is the only one that does understand the child and nobody else can. And then if they're not responding to their name being called or to the environmental sounds, again, parents will be the first ones to notice that. Child may ask you to repeat what you say frequently. That could indicate that there might be some kind of an inhibition to their hearing, that they may hear maybe from one ear and not the other, or they hear dad better than mom, meaning they hear low frequency sounds better than high frequency sounds. And also if there's a history of ear infections. Any questions on any of those? It's a lot of information. No? Okay, next page.
I do. I have a question. I'm sorry.
Sure.
So when the child has frequently ear infections, say he has more than four in a year,
Yeah.
how many times do you recommend them to have tubes put in their ears?
Well, I'm not a doctor, so I can't tell you that precisely, but what I can tell you is what pediatricians have told me, and that is that if the child has 3 ear infections, they will consider the fact that there's a pathway closure, and they will recommend putting ventilation tubes in.
Okay.
Yeah, that's all I know at this point. Nothing's changed over the many years so far,
Okay, thank you.
and they are very helpful. Any other questions? Okay, next page. Okay, and with vision development, okay, normal to typical vision milestones are at birth. Let's see here. They typically will have poor eyesight when they're first born, blinks in response to bright light. The eyes may sometimes be uncoordinated and may look cross-eyed. And if they're able to stare at objects 8 to 10 inches away, that's a good thing. By 6 months, they definitely see in black and white images up to 6 months. However, there are some children, like say, for example, you know, the mobiles that hang in their cribs. A lot of people will put multicolored pastels on those mobiles for the child to look at. Well, the child can't really perceive those very well. So a suggestion is to put black and white or red also can be seen as like a gray up to that point. I've heard children being able to see the black and the other colors even as early as 4 months, but you know, because they're so little and they can't tell us if they see them, that's kind of hard to gauge. But I think if you're putting an object in front of a child and they have good vision, they will look at that object. So they may not necessarily perceive it as a color difference up until about 6 months. Anyway, they will look at their hands. They will turn to see objects. They will turn to look at mom or dad when they walk in the room. And toys, they'll scan their gaze from one object to another. They will touch an image in a mirror and track objects. By 1 year, they should be able to play peekaboo with you and have eye contact with you when you put your eyes up and down, and they'll watch an object with movement and begin to have depth perception so they can see things with a little bit more clarity that are further away, excuse me. And by age 2, they, with a lot of interaction, they can point to body parts. Typically in the beginning, if the parent points to their nose and says, "Where's your nose?" and they'll practice that for a very long time. And that's a great milestone by age 2 to have, to be able to at least imitate 5 to 10 body parts with the eyes, nose, ears, the facial stuff, and the hands are usually easier to learn first. If they're able to focus on objects near and far by 2 years old, and they're able to place shapes in proper holes, by age 3, they should be able to copy shapes and simple shapes and lines, and their vision is nearing 20/20, and they can name some colors at that point. Hopefully they've got at least 3 to 5 colors, if not more. And those are just some of the vision milestones. There are so many of them. We couldn't even possibly have enough pages to fill them all in. But these are some very basic ones that we look at when we're doing assessments. So any questions? Okay, next slide. Okay, the red flags are if the child appears to still have eyes crossed or misaligned in some way, like a bit of a lazy eye. After age 3 months, that's something to definitely pay attention to and bring to the attention of the pediatrician so they can do further screenings. I know that having strabismus, which is where an eye is crossed, is a very simple outpatient procedure, and will help put the eyes from being in this position to this position because they just shorten the muscle of the eye. Child holds a book close to the face. Okay, I'm sorry, I skipped one. Child's pupil appears white looking or different in size than the other in a flash photograph. Sometimes that can indicate a glaucoma, but oftentimes it depends on the camera you're using. Okay, so I'm sorry. The child will hold a book close to the face, again, if there's red flags. And if they continue as they age to still hold it close to their face, you know that they're probably nearsighted and may need to have a screening done. If a child holds objects close to eyes, same thing. And as they start to learn, when they get a little bit older, for letter recognition, reading difficulty, that can indicate a multitude of things, not just vision problems, where you're looking at possible other issues like dyslexia. Let's see here. So family history of vision impairment is a big one, not if grandpa wears glasses, but if, say, siblings or parents wear glasses. Oftentimes that will carry on genetically through the family. Child does not appear to have eye contact with you. That's a big one. And again, it can also indicate autistic type behaviors. But if you're looking at just vision and that's ruled out, then maybe behavioral things need to be taken a look at. Any questions? Okay, next slide.
Hey, Lisa, before you move on, this is Kathy Sprint from First Five.
Yeah.
I'm just thinking how these kind of red flags you may notice if you're working with a family and working on their ASQ with them, getting that developmental screening.
Right.
So just reminding everybody that there's lots of ways to see some of these things that doesn't, necessarily mean a specific hearing and vision screening. You might see it just as you're interacting with the child and the family, right?
Right.
Great.
Like if there's an alignment problem, you'll notice right when you walk in the room.
Yeah.
Yeah, definitely.
Okay, thank you.
Sure thing. Thanks, Kathy. Good to see you.
You too.
Okay, next slide. Okay, there's a screening process, and again, you guys do it when you're doing your ASQs, like Kathy was saying. There's a screening for hearing and vision that takes approximately 5 minutes per child, and that's what I do. I have equipment that I use specifically for those. I have an OAE hearing equipment, which is inserted in the ear, and the machine lets me know if the child hears a sound that's emitted by the machine into the ear by measuring what's coming from the triggered nerve in the middle ear. It'll bounce back to the machine, letting me know it's a sound that's been processed. It does not measure what goes to the brain. That's something that a audiologist or a neurologist would have to do. But if a child doesn't pass the screening, say, for example, then I would refer the family back to their pediatrician to get a medical referral to a specialist to have further testing done. And the vision screening is done with a vision screener. That's basically like a TV screen that they look at, and it screens both eyes at the same time. Now, I used to have one that was a Sure Shot screener, and it would basically screen one eye and then the next eye. The one I use now screens both and also checks for alignment at the same time, which is wonderful. It's like a next step up. So it works really great. Again, only takes about 5 minutes per kiddo, so goes pretty fast. And it gives me a pass or a referral result, and it gives me the numbers that indicate nearsighted, farsightedness, or possible astigmatism. Okay, and when the screening process is done, you'll receive immediate results of pass or fail documented, and any recommendations I make to the family. And the hearing and screening visions can be completed in-home and at any other indoor location. My vision equipment prefers that the lighting be a little bit dim, and that's not on here because I didn't know that until I started doing the screenings, that it's kind of particular about the lighting in the room. But so far it's not been a major problem. I just have to turn off a light or two. Screenings cannot be provided outdoors because of the type of equipment that I have. For vision testing is infrared, so it cannot be done outside. Remote screenings are completed through face-to-face communication and instruction. And we haven't really done those in quite a while since COVID, but there are ways that I can teach the parents how to do these basic screenings at home as well. Any questions? Okay, next slide. All right, so for more information about scheduling a hearing or vision screening, you can contact me, Lisa Pickens, at 209-594-5036, or by emailing me at Lisa or lpickens@ucpsj.org. And I'm happy to schedule a screening with your particular program. And it's pretty simple. I just need a chair for me to sit in, and maybe a few chairs for the children to sit in, and I can screen up to about 5 kids at a time, depending on behaviorally how you think the kids do. So yeah, 3 to 5 kids works great. I need a table to set my equipment on. A really small room works, and again, the quieter the spaces is better for the hearing testing. And that's pretty much it at this time. Any questions at all?
Lisa, this is Kathy again. I'm sorry.
No.
Would you be open to doing like a brief workshop or a brief get together with parents so they understand the importance of this? Because most of them will take their
Absolutely.
kids to their well baby checkups and things like that, but may not think about hearing and vision screenings differently than, they think maybe their doctor would do it. But sometimes that one-on-one piece you can do with them
Absolutely.
tends to get a better result. So is that something that an agency could reach out to you
Yes,
for?
definitely. Yeah, education is all about starting with the parents for sure. Yeah, I agree.
Okay.
Thank you. It's a great idea.
I'm thinking too, Kathy, as you're saying that, that it might be an opportunity for, like, it could be a vision and hearing screenings event, with some parent education component. Because if the parents are there, often the kids are there, and maybe that if the facility is right, the environment is right for it, that could be an opportunity for those kids to get screened as well.
Yep.
And a lot of our programs do have like some kind of parent workshop or group connection
I was just going to say, I've done the
activity.
screenings at the workshops before, and the children are already in attendance as well. Group settings work better, although I can do home screenings individually. It takes a lot of the time during the day. So it's better to get all the kids together in one place if possible in your programs. Like right now I'm screening, school districts and things like that. So I have classrooms where I'm having the teachers pull out kids, 5 at a time and bring them to me to screen in a separate room or in the same classroom. And weather permitting, sometimes the kids can go outside and play since they're just in preschool, and that leaves the classroom pretty empty, so I can get the screenings done fairly quickly, not to interrupt their program days,
Denise at Family Resource says she's always used Lisa for parent workshops. She's great.
Awesome. Okay, sounds great.
Yeah.
Yeah.
And then I'm not sure if Annette is wanting to connect with you, but she put her info in the chat box. And Alicia Marquez says she's always helped us with our workshops.
Yeah.
Thank you so much. Lisa's done a great job. Even the neighbors have benefits. Great.
Yeah. Yeah, it's been a lot of fun. I've been at UCP for quite a few years. I think it's about 24 years now. So, and we've been doing the hearing screening program, I think about 19 of those years. Yeah. So we've kind of gone with the flow of the changes of equipment and school programs and things like that. So everything's very flexible. I'm flexible. So yeah, just reach out. Please feel free.
Yeah, and I'll send this presentation out via email, so you guys will have the information that was presented today, as well as Lisa's contact information, so you can reach out to her directly. Also, Lisa, could you, since we have a little bit of time, could you spend just a few minutes kind of providing for those that may not be as familiar with UCP and the other services that it provides, if you could just speak to that?
I sure will.
Thank you.
Yeah, the UCP, I'll start with our mission statement because that's pretty uh, universal, I think. Our mission statement for here in Stockton at our UCP branch is to enhance the quality of life for people with disabilities by providing services that enable them to realize their goals and achieve their highest level of independence. That is our goal with all of our programs. And the programs that we offer, we're located at 333 West Ben Holt. And at this specific location, we have an adult day program for adults with special needs, where they go out and do day activities and have in-house or out of house. We do have transportation that takes clients to like bowling alleys and things like that for outdoor activities, which is wonderful for them. And we also have lots of branches. We have the San Andreas branch. We have Tracy, Manteca. There's also a program Without Walls here in Stockton. There's the Adult Developmental Center. And then our program is called Clinical and Family Services. And we're like in a building located at 6702 Inglewood, which is right on the corner of Benjamin Holt and Inglewood Drive. It's a separate building, same lot as the main UCP building. And I know we have a group of volunteers that work with the program too. UCP is an accredited organization known for service-based, individual-focused approach. Our strength is nationwide. It's a network that has grown and has a long history of unwavering commitment. I think for more than 55 years now. It's a very, very big nonprofit organization, and I believe that we are funded by United Way. So that's our primary source. Any questions?
Thank you, Lisa. Any more questions for Lisa while we have her captive here?
Wow.
All right. Thank you so much, Lisa.
Sure thing.
Always a wealth of information you bring to our meetings, and so we really appreciate you continuing to train on this topic for us. And again, as I mentioned, this presentation will go out, so please look for that so you can have all the information that Lisa shared here today. And then please do reach out to her. She is available. It's a wonderful service that's provided at no cost to your families. It's a great support for, the programs here that are working with families with young kids. So please do reach out to her. All right. So thank you, Lisa. Okay. So lastly, we want to end our meeting with, and give me a moment. I'm going to share my screen again. I think I have a final couple slides with some updates and announcements. So if you all have anything going on in your programs or agencies, any events, any new programs that are launching or services or campaigns, maybe a new resource you want to spotlight, this is the time that we dedicate during our meetings to give some space for that. So please unmute yourself and share. Is there anything going on in 2025? We might all still be getting our bearings with the new year.
Like Happy New Year.
I know, right? What day is it again?
We're still recovering from the
All the
holiday.
holidays. Yeah. I think we're all just like half
We
awake
still don't have
today.
a schedule, have everything that Concilio has.
Yeah.
If not, we would give you like the dates. We usually have a calendar for the whole year of the food, but they haven't got that ready. So
Yeah.
as soon as we do that, we can send that out.
Yeah. Same. We're firming up some things too on our end. So I didn't have any first five updates to share, but if there are others that are oh, Sandra has her hand up.
Well, hello everyone.
Hello.
I would like to say that on January the 23rd at 11 a.m. to 1 p.m., we will be at the Family Resource Network, and this is for children and youth with special health care needs. We're going to have a peer support group, and on the 23rd of this month, it will be hosted by Nikki Moss, who is the program coordinator at Family Resource Center, and we're opening it up to the public, and it's free for your families to get additional support and resources at this time to help them with their needs. Thank you.
Wonderful. Thank you. Do you have a flyer that can be
Yes,
shared
I
out?
do.
Can you
Okay.
email it to me?
Okay, I
Yeah,
will.
okay, thank you. And then I'll
You're
send
welcome.
it, I'll include it in the follow-up for this meeting.
Okay. Thank you.
Thank
Appreciate it.
you. Thank you.
Happy New Year, everybody.
Happy New Year. Anyone else? Anything going on?
Yes, good morning. This is Philandra. How's everyone?
Hey,
Happy New Year
Happy New Year.
to you all. Um, I would just like to, and this is starting in February. We decided to push it back, but we're doing some financial literacy classes. We're going to call it Getting Your House in Order. And we will be conducting those on Friday afternoons for families. We will also be doing some for youth, and that's to be announced shortly. We're just making sure that, we get it on the right day at the right time. There's no greater time than to teach our children now, what finances look like, what budgeting look like, what a high yield savings account looks like. So we're excited about that. But I do have a flyer that I will send to you, so you can distribute it out to everyone. But I would love to see everyone in there, even the best ones. We need your expertise. If you know budget, bring yourself, so you might be able to help someone else. So I'm excited about it, and I hope to see everybody there.
Thank you, Flandra. So, getting other questions in the chat for the flyer. So yeah, if you could just send it to me, and then I'll make sure it goes out in the follow-up for the meeting.
Absolutely.
Thank you. Okay, I saw a couple hands being raised, but I don't know who those hands are connected to. So if you want to just unmute yourself, my view doesn't allow me to
I see Annette
see that. Is it
DePaul.
Annette?
Hi, happy Friday,
Hi.
everybody.
Yeah, happy Friday.
We are having Give Kids a Smile coming up on February 7th. I'll try and put that in the chat. No, February 8th from 8 to 12 here at St. Mary's. It's a screening where we have volunteer dentists that come on campus, and they do a general screening, and they'll do some light treatment that day as well, and then get the kiddos connected to additional services if needed. So it's a big day for us, and want to put that out there for anybody who knows that would benefit, especially if they're non-insured or underinsured. There's a lot that nowadays, fortunately, DentaCal helps, but this is in addition to that. So I'll do my best to get that in the chat. Okay.
Great. Thank you,
And then I'll
Annette.
send it to you also.
Perfect. Thank you.
Thank you.
Annette, is that only for you guys, or do you guys would be accepting like other agencies to provide information too?
As far as like tabling
Yeah.
information, I need to double check about that. That's a really good question, because it's my first year here doing that. So Liz, can I get back to you on that one?
Yes, please.
Okay, because I was also thinking what a wonderful opportunity this would be to potentially doing some vision and hearing screening if we could. So Luz, you're with
El Concilio,
that's what I
California.
thought. Okay, yeah. Okay, let me get back to you on that. And what were you thinking would be good information for that day?
Just regarding our programs that we have,
Okay, great.
we always have to have a client list, waiting list, because people drop,
Sure.
so we like to have that always a backup, right, Giovanna?
Okay. All right, sounds great. Let me check on that, Luz, and then get back to you. Can you put your email? Can you send me your email?
I sure will. Thank you.
Thank you.
Annette, if you could also, once you receive that clarification, just let me know as well. And I can put it out to the group, to the Community Links group, because there may be other agencies, if it's open, that may be
Right.
interested in tabling or doing some outreach at the event.
Okay, great. We
So we
appreciate
can
that.
let
Thank
everyone
you.
know. Thank you, Annette. Okay. Others, any other hands up? Any other questions? Let me check the chat.
Giovanna, this is Kathy, and
Uh-huh.
I'll make sure you get the flyer, but we're going to be doing an ASQ SE training Tuesday, January 21st. And like I said, I'll get the flyer out to Giovanna, but it will also post it on our website. This will be in partnership with Alyssa Cheadle at Family Resource Center. So we're really looking forward. This could be a refresher for any current staff that are doing ASQs. It could also be for new staff, or if you just need more information on the ASQ, ASQSE screenings.
Thank you, Kathy. All right. Anyone else? Any final thoughts, remarks before we wrap up? Any other hands? I don't want to miss anyone. No. Okay. I think we're good. Thank you, everyone. Oh, I see. Oh, I think that's a message. Hi. Maybe not for the group. So I'm not going to read that one, Claudia, unless you wanted to share something. And if so, feel free to unmute yourself.
Giovanna,
Yes.
it's the show with Helpline of San Joaquin. I'm trying to come
Hi.
on mute, but so Helpline of San Joaquin is now this year we're also an open site for the VITA program. We are doing a drop and go for Saturday's appointment. So any families that qualify to do their taxes through VITA, they can call the 211. The 211 line will actually set up all the appointments for families. And so Helpline is actually partnering up with United Way. So our site at our main office at French Camp will be one of the divided site as well.
Great. Thank you, Sheila.
You're welcome.
Do you have a flyer for that? I feel like that's my question for everybody. Do you have
Yeah,
a flyer?
so
Okay.
let me get one from Shawnetta and then
Okay.
I'll send it to you.
Yeah, shoot it to me. Okay. Thank
Okay,
you.
perfect. You're welcome.
All right. Anything else?
Yeah, everybody if anybody has any outreach out there, send it to Giovanna. She'll send it to us. We're starting the year. We want to start fresh and start getting all our outreach that we need to.
Yeah. Thank you, Liz. Okay.
Could you hear me?
Oh, I see Angela has a hand up.
Can you hear me?
Uh, yes, but your voice is low.
No. Okay.
It's a little difficult to hear. If you're able to speak louder or
Can you hear me? Is it
yeah,
louder?
it is low. Your voice is low.
Low.
But go ahead. We'll do our best if you're not able to adjust your volume.
So I will be sending you a flyer. The month of February, we'll be celebrating Black History Month. And I will be talking to you to see how I could get more information, to connect with all these partners, community partners. We really want to promote Black History Month this year and maybe find an opportunity to come in and present Black Infant program to some of our community members.
Okay. Thank you, Angela. Yeah, let's connect.
Yes, thank
I'll
you.
reach out. Thank you for that.
All right. And please forgive me. I just saw an old friend on the screen. I want to shout out. Annette, can you hear me, DePauli?
Is Annette still on?
Yes, I do. Thank you. I saw you. I'm like, oh, how about that? It's nice to see your name and hear your voice.
Oh, God bless you. How you doing?
Good. Thank you.
All right.
I also have one other thing she reminded me is we here at St. Mary's, we have COVID tests that we're trying to disperse to homeless. Anybody who is a provider or would have a need for COVID test, if you could maybe let me know, and that's we have them free we can bring them and get them to you.
Okay, that is great to know. So they can just reach out to you directly and request,
Yeah.
okay, a supply. Okay.
And we're kind of like a provider most focused on homeless, but you know, if you're a provider who does homeless and others and you could use the test, please let me know.
Okay. Thank you.
That's great, Joanna, because a lot of the families that we were visiting, they're just thinking, oh, it's just allergies. Oh, is this it? It doesn't hurt just to go ahead and do the test, have some at home, you know?
Yeah. Yeah.
So Luz, would you like me to see about getting some to you over there?
That'd be great. Yeah.
Okay. All right. We'll get a case to you within the week, next week.
Okay. Thank you.
Oh, also, I put the information to the children and youth with special health care needs for Cal
yes.
Inspire
Okay.
support group. It's in the chat.
Oh, this is under Cal Inspire. Okay.
Yes, Cal
Thank you. I
Inspire.
missed that part. Okay.
Yeah.
Just copy that and I'll include that information in the follow-up. Thank you.
Okay.
Okay. Anything else? Great information, great resources. I don't want to miss nothing, y'all. Speak up if you have anything. Okay. I think we're good. All right, everyone. Yes, thank you. I think we are okay to wrap this meeting up. Thank you again to Lisa so much. Thank you so much for the information.
Sorry for the confusion, and thank you for having me.
Yeah, no, all good. Worked out well. So thank you again. And thank you everyone for being here, and thank you for sharing and connecting, and happy New Year. Welcome 2025. Everybody have a great weekend.
Thank you.
Bye.
Well.
Thank you.
Hi, Angela.